It's time again for me to do another very careful reaction video to a Joe Rogan interview of this time of Dr. Mark Cortin. Great interview.
The whole premise of everything that I've been doing for the last 30 years has been based upon inflammation in the brain.
Lots of good information, 3 hours long. I don't know, I found this stuff about the California black bear and brown bear and stuff. I actually found that kind of interesting in there that especially Joe knew a lot about that. Joe knows a lot about everything, obviously, but you know what? So do I, though. Not a lot about everything, but a lot about some really specific things. First of all, I want to say good job, Mark Gordon, Dr. Gordon. Wow, impressive. Please forgive me for saying this because I don't want to sound all arrogant and everything. But you know what? Good information. You're running about 2 years, maybe 3 years behind us in the work we've done. Let's delve into that because I think there's a few things that are really worthwhile pointing out.
So we've had, using our protocol, we have our 6th case of multiple sclerosis that was totally put into remission. It took 90 days.
And what's the protocol that did that?
The protocol is the Nutraceutical that drops the inflammation and replacing the hormones that are deficient that protect the brain.
What is in the nutraceutical?
In the nutraceuticals, there is Quercetin. You know about Quercetin.
Mm-hmm.
It's got DHA from omegas. It has in it glutathione, N-acetylcysteine. It's got B12. That's on one component of it. The other component has B1, B2, which deals with neural communication. And then it's got PQQ and CoQ10.
You talked a lot about glutathione. I did 10 years of pituitary endocrinology, cardiology research at the University of Southern California, or with a team from the University of Southern California. We were over in La Habra playing around with trying to make the first functional glutathione. And you talked a lot about glutathione. We're going to get into the brain trauma stuff too. But I just want to clarify this on glutathione. I saw it in several of your products on your website too. And since you spent all the time on it, whenever we weren't working on pituitary endocrinology, cardiology work, we were looking at trying to figure out how to make the first functional glutathione. There were probably 60 of them on Amazon back then. And I think I bought all of them. We looked at all of them and just like, well, that doesn't work. Well, this one won't work. Well, here's the reason why. We knew a lot of set reasons why they wouldn't work. I can share those now because we have patents on everything. We have validation on everything. We're going to talk about that too more later. But we look at all those and go, well, this is oxidized trash. We created some laws of antioxidants, of functional antioxidants. It's called VARS. VARS, V is in victory, ARS. The first law is validation. If you don't have a validated product, you don't have one that works. You can make all the weird claims you want. You can make all the incredible claims you want. But if I ask, show me the validation, show me that you can increase both cellular and intracellular GSH levels and increase the ratio and change the ratio and all that, then you don't have a validated glutathione. The second law has to be absorbable either topically or orally. IV and rectal doesn't really work. I mean, there's not a working IV glutathione out there. I'll tell you that too. And everyone's going to jump up and go, yeah, mine works. You know what? Not FDA level to be in every ER, every ICU, every ambulance in the world, if it was. Glutathione deficiencies occur from a number of reasons. One is you're low in one of the 3 amino acids that make up glutathione. It's a tripeptide, so it's made of 3 amino acids. The other, there are a lot of genetic reasons. You need to look at the genetics of these people to tell if they can't make it. But we also have testing. That intracellular vitamin panel we use shows glutathione levels, and it tells us whether it's oxidized or not. So it's really effective. And so we can tell you if you have a low glutathione level. And Dr. Gordon, you didn't even discuss that. Do you check levels? How do you check them? Do you have validation? I couldn't see any validation or patent work done on your product. You can't have a functional glutathione if it's oxidized. That's critical. So had to be validatable, had to be absorbable, had to be reduced. That's the R part, not oxidized, reduced. It's the biggest problem on Amazon. It's the biggest problem with all the other ones out there. Matter of fact, it's the biggest problem with all antioxidants. We can apply that law, and it is applicable to any other antioxidants, especially the super antioxidants, because the stronger they are, the more they tend to oxidize, the more they tend to grab oxygen and oxidize and become worthless. I mean, we don't even think vitamin C has been done correctly. We're coming out with a new reduced form of vitamin C that fits the VARS standard. We'll call it VARS vitamin C. We're just doing a lot of really cool things out there that all involve antioxidants. So I'm the guy, that's my wheelhouse. You talked about glutathione. I just wanted to correct that, just kind of point out there's a higher standard. Second, let's talk about brain trauma information.
Why is it that you develop CTE or the symptoms relative to CTE? Why is it that you develop the symptoms relative to Parkinson's or Alzheimer's or multiple sclerosis? Well, it turns out that the biochemistry is all the same. Something called beta amyloid, which is the hallmark for someone with Alzheimer's disease, and then these tau proteins, hyperphosphorylated tau proteins that they call NFTs, that they circulate around the blood vessels, and they create this intense inflammation, and that intense inflammation causes loss of blood supply, damage to neurons, and you develop it. So you have to drop the inflammation, because inflammation causes mitochondria that produce ATP. It causes mitochondrial dysfunction. So in all those neurodegenerative diseases, mitochondrial dysfunction has been ignored in the past.
I gave a talk at AMMG May 2022 meeting. AMMG is the American Age Management Medical Group. I was one of their morning speakers. It was all about brain trauma, traumatic brain injury, which I've had, and proper therapy for it, proper nutraceutical therapy for it. And everything we used in that study, everything I discussed in that study had to be proven it worked, had to be validated, or you're given, no one knows what you're giving. So the Quercetin, there's only one I know of in the marketplace that's validated. The resveratrol, there's only one I know that's validated. Astaxanthin, there are two that reach validation points. Astaxanthin is critical for preventing the neurofibrillary tangles you discussed. On and on we went. We were also indirectly involved in our work in California with the NFL brain trauma CTE study. We looked at MRIs, we looked at a lot of data, and the Nevada Boxing Commission data, we discussed that with them too. So we're involved with all that on brain trauma. So we were pretty knowledgeable on it. Plus I'd had brain trauma myself. And I know you sometimes can hear me slur my words, stuff like that, but I don't have dementia. Don't plan on having dementia. There's so many things you can do to offset it.
In the train of thought on Alzheimer's, they're saying that it's due to the recessive genes. Well, if you look at the studies recently, 95% of the cases of Alzheimer's disease appear to be due to trauma and aging.
You got to look at the genetics again, the glutathione genetics. You look at the NTRK2 and NR3C1 genetics, because lack of those, you can't make phosphatidylserine. If you have SNPs or homozygous, and often I see patients that are homozygous times 7 homozygosities on the NR3C1. On the NutraHacker imputeds we look at and the completes, that means they can't make phosphatidylserine in adequate amount for the brain. I don't see anything about phosphatidylserine or lithium, which is really critical also for preventing dementia. I'm not talking about lithium, the drug lithium orotate. So phosphatidylserine prevents brain inflammation. You talked about brain inflammation. You didn't even mention it. Maybe you should next time. Phosphatidylserine is awesome. Some people just can't make any phosphatidylserine, so they get a lot of brain inflammation. If you have those SNPs on your genetics, you need it. You got to look at the genetics. You got to look at their glutathione genetics. You got to look at their NR3C1 and TRK2 genetics. You're also going to look at their fish oil genetics. The fish oil does help the brain, but not like astaxanthin does. It's crazy what that does for the brain. And you got to take so much amount of it, very set amounts. You can't be guessed at. There's studies that show you how much astaxanthin say you need in a day. I went into all that. Is that video is that still up, that PowerPoint? Yeah, danpersermd.com/dementia. So my video from that, where I give that talk afterwards for the population, I couldn't use the one there because they recorded it. Yeah, so you need to look at that video if you want to learn more. I talk about the validation. I talk about what works and what doesn't work in the marketplace. I looked at everything. I spent months. That talk was for me. It's for everyone out there like me. In our product, Bright Brain, we have all that in there, by the way. I'm not trying to sell it, Just saying that.
So what quercetin does is it increases mitochondrial replication in about 7 days, doubles the amount of mitochondria intracellularly. It helps increase in the liver something called IGF binding protein 3, insulin-like binding protein 3. Binding protein 3 is always looked at as being the carrier for IGF-1, insulin-like growth factor, growth hormone, turns on in the liver the production of insulin-like growth factor, which is the main below-the-neck growth factor for our body, improves protein synthesis, decreases inflammation too.
Wow.
Quercetin, once validated, it's amazing. It's amazing when it validates. And what it does is off the charts cool. You were talking about some of those benefits of quercetin. Trust me, they're a lot stronger, a lot further along if it's truly reduced. And reduction is different than validation, but it's kind of the same thing because you're looking at that. So much of it needs to be reduced to be functional. So remember the laws of antioxidants, VARS.
One of the misperceptions is, as you said, and I apologize for that, is that we think it's all due to pituitary gland, but it isn't. In the work that we've been doing, it shows that when you have inflammation in the brain, regardless of how it's developed, it creates this inflammation that shuts off the ability of the brain to regulate the pituitary gland. So
Pituitary damage, reiterate this again. You don't know you have it if you have a bunch of vitamin deficiencies. If you have intracellular vitamin deficiencies, it's going to affect, or even serum levels that are deficient, it's going to affect your ability to make hormones, either ovarian, pituitary, hypothalamic, thyroid, whatever, testicular. You're not going to make them if you're malnourished. So you got to clean that slate out first, and then you can truly evaluate. Then you can order an MRI. Then you can figure out if because most MRIs look normal. And you better go check that MRI too once you order it. And just because you show damage of the pituitary on the MRI does not mean you have a damaged pituitary hormonally wise. Another thing, we can check intracellular lab levels, or they're assumed to be intracellular lab levels that with the new micronutrient assay we use that we've been using the last few years. It will tell me levels of glutathione, of superoxide dismutase, of quercetin, of resveratrol, and even astaxanthin, which against that krill oil, and it's not really official, but it's a krill oil that can get in the brain and help with the fibrillary tangles. All this is critical. You got to do all this. So we check those levels, and I can tell you if you're on adequate amounts to help your brain. It does not look in the CSF, but it does. You can assume from the serum levels or the intracellular levels inside your white blood cells that it's that high inside your brain. So, and we can also tell how much of the glutathione or SOD or other things are, how high they're oxidized or not, and what percentage is oxidized. It gives you a rough idea. So you can tell they've got lots of glutathione, but it's oxidized, which makes it actually GSSG, not GSH. You can get a good idea how to deal with that. So, and there's a lot of other reasons why you want a validated glutathione or a validated quercetin or a validated resveratrol or a validated astaxanthin. So you know that you're getting adequate dementia prevention. And the test is reasonable. I'm not trying to sell it. I'm just telling you, Dr. Gordon, that you can check those levels and not guess on any of this. Thank you.